Everyone, and welcome back to the channel. FMG clinical cases list is what we are going to be talking about today, specifically for non-clinical subjects. So without wasting any time, let's get started. Hi, my name is Smita Singh and I have done my MBBS from CTGU and I have recently cleared my FMG December 2020. So the non-clinical subjects basically are the anatomy, biochemistry, physiology, pharmacology, pathology and stuff which you need to focus on the clinical aspect as well. Before it, people didn't used to focus on the clinical aspects of these basic subjects specifically because the questions were not asked on those. But with the changing trend from the August 2020 exam and then December 2020 exam, they have really started asking more and more clinical subjects, more and more clinical questions from those basic subjects. So what we would want to do is prepare in the same way. Just don't basically read the basic subjects, also know what the clinical questions can be asked from those basic subjects. So this video would be comprising the anatomy list. I'm not going to explain and read the list content one by one, but there they are. I have made the checklist. You can have a screenshot of it or you can write it down or pen it down on your notes or the planner you have, and you can just check it off your list when you're doing those subjects or when you're doing that system. So I've divided the list or the video into the system wise, which is like upper limb, lower limb, like we have it in our anatomy. So if it's helpful, please do let me know and we can make more of those. I really hope this could help you in some way or the other. So this is the list for the upper limb. It does have 13 points, which includes the most important things which you could not afford to miss. I do not want to make it a very long video, very exhaustive one, because then it's no point, because I know how much precious the time is for you all. So this list I'm not going to read one by one, but you should have it checklisted and everything in this you should know of, because questions have been asked in past on these and there are high possibilities, high chances that the questions coming into the future would be out of these only. So the humerus fracture, avascular necrosis, elbow, especially the elbow, the named things, everything which is named like tennis elbow, golfer's elbow, student's elbow, these things are really important. So this is the list for upper limb. The next is for lower limb. Lower limb doesn't have much of the things, and many of the lower limb topics do fall into orthopedics as well, like clergyman's knee, housemaid's knee, compartment syndrome, and this Marsh fracture. These things you would get to Trendelenburg test. These things you would get to read in ortho again. But if you get done with them now, then reading them in the ortho would be like a revision and it would be really helpful for you. So, neuroanatomy, we have these 12 things. Head trauma and these things will come in surgery as well. And some of the things are in covered in medicine also, and some of the things like spina bifida, occulta, and cystica is also covered in pediatrics. So many of the things clinical questions asked do fall under the other clinical subjects, but we tend to miss them sometimes and they get neglected or something. But if you get done with them while you're studying anatomy, then when you study them again in the other subjects such as pediatrics, medicine, or surgery, whatever, then it would be like a revision and you would know what to focus on. Like the topics which are getting overlapped or which are getting repetitive in one or more subjects, that definitely and definitely have more potential of getting asked in your exams. So the next part is miscellaneous part. I didn't keep everything of thorax, abdomen, and everything because mostly thorax and abdomen, whatever clinical questions are there, they also are present in the surgery part. So but I did have some of the points which I really thought are important, and I shouldn't miss them out in case someone didn't read their surgery or medicine and pediatrics or gynae very well. So I just named a few of them which are really important and get asked frequently in the exam, such as dangerous triangle of face, nerve supply to tongue, Little's area, sacrococcygeal teratomas, craniopharyngeal teratomas, omphalocele, twins. They do like to ask about twins, monozygotic, dizygotic, you know those things, right? And then Hirschsprung disease, Meckel's diverticulum, Zenkel's diverticulum, annular pancreas. I think they asked this in December 2020 exam as well. It was a, I think it was a image based question. So yeah. So what suggestion I would give you to go with it is have this checklist while you're just reading these topics, like while you're reading your neuroanatomy or lower limb or upper limb, have this list by your side and keep marking it off your list that you are done with it, and have a short note, like uh, a go-to flashcard that these clinical scenarios you're gonna do it twice or thrice. So if the case question comes, there's no way, there's no way you will miss it. So, and these four things, I found it somewhere in other books too, like in other subjects too, and I feel these are not that much focused on, but these do have a good potential to be asked. They are not very repetitive, but I think in these coming exams, in this coming FMG of June and December, they might have higher chances to getting asked. So higher chances of getting asked. So these four, especially cleft palate and DiGeorge syndrome. DiGeorge syndrome, I've seen a lot of times they ask a lot of questions about it. So there's a high possibilities you can come across one of these. So please don't ignore them as well. Yeah. So that's it. If this video has been helpful for you in any way, do write in the comment box and do let me know. And if you think I can make more of these, or do you want anything else, I'm really open for your suggestions as well. Thank you for your precious time and wish you all the best. Thank you.